Well, medical studies show strokes can hit at any time. It is the fifth leading cause of death in the U.S. and the leading cause of disability. This is Stroke Awareness Month, and the goal is to teach the public the signs, the symptoms, and how to prevent it from happening to you or someone you love. And they want you to remember these things all year long. With us today is neurologist Dr. Lauren Charette with West Jefferson Medical Center, as well as stroke and patient survivor Rayanne Duplessis. We thank you both for coming in. So appreciate you being here.
Thank you for having us.
Doctor, let me first start by asking you, what exactly is a stroke and what causes this?
So there are two types of strokes. The first is what we would call ischemic. That's when something gets stuck in a blood vessel, like a clot or a piece of plaque, that prevents blood flow from getting to part of the brain. The other type of stroke is a hemorrhagic stroke, when there is a breakage in a blood vessel in the brain and you actually have blood going somewhere it shouldn't be.
Who's most vulnerable?
Everybody is at risk for stroke.
Any age?
Any age individual is at risk for stroke. There is a higher risk with greater age and having certain medical conditions, and increase the risk exponentially. For example, high blood pressure uncontrolled, hypertension, high cholesterol, smoking, and being overweight. Those can contribute as well.
Those are some key things that could trigger it. Rayanne, I mean, you're fortunate you're here with us today.
Yes, ma'am.
You know, we know stroke could always turn tragic. How were you able to survive it? What happened to you?
I woke up that morning and I just had signs of a stroke. I didn't know it was signs of a stroke. I had a crook in my neck and I had a migraine. I worked all day. At work, my legs started getting numb. My arms started getting numb. I had the signs of fast. And as I was walking, I was dragging my legs. So I realized that I was having a stroke with the tingling in my arm and the tingling in my leg and my tongue. My voice couldn't really speak well anymore, so I knew I had signs of a stroke.
Did you take yourself, or did a loved one take you to the hospital?
Actually, my job called 911 and they took me in the ambulance.
And how crucial is that, getting to the hospital if they recognize the signs immediately?
It's absolutely critical. Coming immediately by ambulance, calling 911, and presenting to the emergency department is the best thing you can do as quickly as possible. We say time is brain. If you get to the hospital quickly enough, there is treatment to potentially reverse a stroke.
Tell us about the acronym that tells you what to look for with your face, your arm, your speech, and time. Go down that so that our viewers know what to look for.
Sure, that's an excellent expression. It's very helpful. So FAST, F for face. If you detect any facial asymmetry, if you think that somebody may be having a stroke, you can ask them to try to smile and possibly detect a facial droop. Arm is, you can either detect weakness or a sensory disturbance just by having someone elevate their arms. You may detect a drift on one side. S for speech. Somebody's either having difficulty producing speech, articulating, or slurring. And T for time. Call 911 immediately if you have any suspicion that a stroke is occurring.
And Mr. Duplessis, what would you say to people who say, you know, chances are it's not going to happen to me, or, you know, what do you say to people? Because I know we're going to talk about the screenings that are coming up. What would you say to people who say, I've never had it in my family?
Always remember FAST. I didn't think it would happen to me. Go to the emergency room ASAP. Just know if you feel any tingling, anything with FAST, arm drooping, anything that you think might be a stroke or might not, just get yourself, go to the emergency room ASAP.
Okay, and tell people where they can go for the screenings, doctor, so that they can get some more information.
So as part of Stroke Awareness Month, this Friday, May 6th, from 9 a.m. to noon at West Jefferson Medical Center, in conjunction with the Clickia Neurological Clinic, we are going to be having appointments for carotid artery screenings. You need to call and make an appointment. I believe the number will be provided. Those will be free by appointment. There will also be free blood glucose screening and blood pressure monitoring and strict
to see if you have the things that can trigger a stroke.
Yes.
Okay.
Risk modification, a package basically. There also will be cholesterol checking at a small fee to patients.
Okay, well, we have the information there on our screen, and it's really important. We thank you both so much for coming in, and, you know, thankful that you're here. And, you know, and also it's important to go and get these screenings, because even if you survive, you could be left, like, confined to a bed. You could be left without the use of your arms or your legs. So it's really important to check those things out.
Stroke is preventable.
Yes. Thank you guys so much. Thank you for coming in.
Thank you for having us.